I believe that I have many colleagues here in the school who have had such tremendous leadership in terms of their work, whether it's research, whether it's their practice, and whether it's their teaching. And so I really am very proud as well as humbled to follow after Dr. Marie O'Corin, who received the award 30 years ago, or 40 years ago, I think.
Well, I had the opportunity to meet Karen about 15, 16 years ago when she was a professor in a school in Florida. And I was immediately struck by how impressive she was, the work that she was doing in a very small institution without much infrastructure, and also the quality of work that she was doing.
It really struck me how much the cancer diagnosis and treatment interfered in so many ways in their lives. I said one particular group of young women, we were seeing so many patients with breast cancer, and they particularly had questions about having children after treatment. And that was a big deal at the time because clinically we didn't have a lot of information. So I thought more about it, and I decided I would go do some research in this area. And I walked across the street. I was in Boston at the time, and I was at the Beth Israel Hospital, and walked across the street over to the Harvard Medical School library. And in those days, you just couldn't find something, electronically. You actually really had to go into the stacks and old card files that were really musty. And so I found several publications, and the most interesting one was in 1936, published in the Annals of Surgery.
Karen's work here at this institution is really remarkable, and it's going to be very important going forward because we're moving into a new healthcare delivery system where understanding quality of life, survivorship, improving the care of the patient is critically important, and she will play a big role in that.
There's not a playbook for surviving cancer. Dr. Meneses, she's actually started to create a playbook for survivorship with an infrastructure to really support families, caregivers, loved ones of cancer patients fight the disease. For me, that's everything. I'm a 5-year survivor, and there are many things out there now to support young breast cancer patients and their families than what I had just 5 years ago with a diagnosis. And it encompasses so much within the city, and it's not limited to just the UAB breast cancer patients. It's cancer patients throughout the state that are faced with a cancer diagnosis. Their families, their caregivers, their friends, anyone and everyone that's impacted by the disease.